You're listening to Rise, a Christian birth podcast for encouragement, education, and biblical truth for birth without fear. I'm your host, Manna, childbirth educator, doula, and mom of three, here to help you rise above fear and prepare for a faith-filled birth. A lot of women will choose their OB or midwife for birth kind of the same way that they might choose their dentist. So it might be like, well, this is where my best friend goes, or my sister, or whatever. Or maybe it's like you already have someone who you see for well woman care. You've already gone there for pap smears and UTIs, so yeah, I guess they'll just deliver my baby too. But your gynecologist might be wonderful at women's wellness and still have a birth philosophy that does not align with the kind of birth that you want. Birth is a totally different specialty, different skills, different mindset, different philosophy, different goals. So we are breaking down how to interview a provider for birth, what to listen for, what questions you can ask to actually reveal their beliefs about birth. You know, those routine gynecologist visits are about disease screening, right? They're about making sure you don't have anything super wrong and problem solving, maybe birth control or hormone issues, things like that. Birth is a physiologic, hormone-driven process that requires patience. It requires trust in the body. It requires respect for variation. It requires respect for patient autonomy and shared decision making. So your provider could be warm, highly trained, great with annual exams, wonderful at diagnosing UTIs, and still be very intervention heavy, impatient with normal labor variation, uncomfortable with unmedicated birth. And if you don't intentionally ask questions, you might assume that you and your provider are on the same page, and then you get surprised at 38 weeks when the cascade of routine intervention starts. Interviewing is how you prevent that. It's how you know what your provider's approach is really like, what their birth philosophy is like, and then you can know what to expect. And particularly if you have specific birth goals, like you're wanting to avoid pain medications or you're wanting to avoid surgery, anything like that, if you have those goals, interviewing is going to help you find somebody who actually is supportive of those goals. So a lot of times when you're asking your provider kind of about their approach to birth, so let's say we'll just continue with the epidural example. Let's say that your goal is to give birth with no epidural. That's what your hope is. And you go to your provider and you say, are you okay with me giving birth with no epidural? And they say something like, I support any kind of birth as long as it's safe. My top priority is a healthy mom and a healthy baby. That's like my least favorite line that providers give. Not because it's bad. There's nothing wrong with them saying that, but you have learned no information from that statement. You have learned nothing about their philosophy, nothing about their approach, nothing about what they view as routine or necessary intervention. No provider is going to say, I don't care about the safety of you and your baby. That line is like a restaurant saying, our top priority is to serve edible food. Yeah, obviously, but like they have a certain kind of food that they usually serve. So what you're trying to get to is like, okay, what do they view as normal? What is their typical approach like? Are they actually open to all kinds of births? And you want to get to the heart of those things. So we're looking for very specific answers. One question that I really love that sort of opens everything up is, how did you get into this work? Why did you decide to become an OB? Why did you decide to become a midwife? I think this can just be really revealing. People mostly don't lie about their origin story, so if you get them talking about themselves, it can be really revealing about kind of their motivations, and whatever motivated them to enter midwifery or obstetrics is probably still shaping how they practice today. A really wild story that I love as an illustration of this is I had a client who was planning home birth, transferred out of home birth care to go to the hospital and be induced. While she's there at the start of her induction, she asked her attending obstetrician So why did you decide to get into this line of work? And his answer was, well, I just really love surgery. This was a mom who was planning a VBAC. So she was actively trying to do everything she could to avoid surgery. And now here she has this provider who the reason he got into his job was because of how much he loves surgery, and he was hoping to have as many opportunities to perform surgery as he possibly could. It's not bad, again, it's not good or bad if your doctor loves surgery or loves natural birth or whatever, but it does reveal their philosophy. And so, if you have a goal to avoid surgery, you might not want a provider who got into this field because of how much they love surgery. Now, if you are in a situation where you know you're going to have surgery, or you're choosing that, or you know that it's medically indicated for you, then yeah, you might want to go out of your way to have a doctor who's really, really good at surgery and that's their favorite thing and they just love it. But do you see how that's not going to be what's best for everybody? And asking that question months ahead of time and understanding their philosophy months ahead of time is what's going to help you avoid having that misalignment of goals and ideals. Now, on the flip side of that, I also heard a story where the doctor explained that the reason that he got into obstetrics was that he had grown up on a farm. He witnessed animals giving birth around him all the time. And he said something like, I just thought it was so cool. Like, we really didn't have to do anything to help. Their bodies just knew what to do. The animals knew what to do. It was so amazing to witness. And God's design is just so beautiful. And I decided to get into this work because I just love God's design and I want to support it as much as I can. Okay, so that might be somebody who, if you're planning an unmedicated natural birth and you're trying to avoid surgery and trying to avoid medications as much as you can, that might be a better answer when you're choosing who you want to support your birth. The next question is, what interventions do you recommend for all women? And it's a little bit of a trick question because if they have any answer to this, like if they say any intervention that they're recommending to all women, it means that they think all women need some kind of intervention. That means they're not waiting to see what happens, waiting to see what might be needed. They automatically are going in assuming that XYZ thing is going to be needed. Individualized care means you look at the individual woman and what medical indications she has. So if there's anything that they're like, well, we give all women, I don't know, IV fluids or whatever, it kind of shows that they view birth as inherently needing intervention. That might be a good provider for you if that's how you feel also. But if you are viewing birth as a natural process, as God designed, and trying to avoid anything unnecessary, then that's really good information for you to have, that that's how they're thinking about things. So if they're saying something like, we break the water around 4 or 5 centimeters to speed things up, or all first-time moms get continuous monitoring, anything like that, each one of those tells you that their default mode is to manage your labor rather than to support it. There's a big difference between supporting labor and managing labor. Other answers that might be more physiologic birth aligned would be, we individualize everything, we just wait and see, and we don't intervene unless a clear medical reason arises, we avoid augmenting unless it's truly necessary. And even then, I would say, okay, there's a follow-up question. What do they consider to be truly necessary? When do they think it's truly necessary? I also think this question about what interventions do you recommend for all women can help you to reveal hospital policies. So sometimes the answers are coming from the provider's individual preferences themselves. Sometimes it might have more to do with hospital policies. So you can ask more clarifying questions about that too. Is this something that you recommend? Is this something that's just kind of standard operating procedure and routine at the hospital where you work? Which is all just really good information for you to have. The next question that I really love, and this truly is no matter what kind of birth you're planning, ask how they feel about unmedicated birth. So even if you're not necessarily planning an unmedicated birth, ask how they feel about unmedicated birth, because unmedicated birth is essentially birth, like at its core. You're looking for whether they celebrate it, whether they tolerate it, or whether they sort of quietly discourage it. Quietly discouraging it might be those answers you get where it's like, We love it when moms are able to do that, but we know that most moms really can't, and we want you to be open to whatever happens and not try to control it. And, don't really bother making a birth plan because it's just so unpredictable, blah, blah, blah. That would fall under quietly discouraging it. It's not actually supporting it. Whereas celebrating unmedicated birth might look like, yes, you can't ever control everything that happens in birth, but we want to do everything we can to help you prepare for unmedicated birth if that's your goal. Above and beyond would be if they're like, we want you to take a childbirth class. We want you to hire a doula. Those are evidence-based, like proven things that help increase your odds of having an unmedicated birth. So a provider who's truly supportive of that is going to know that and is going to want you to do those things. You can ask, what percentage of your patients give birth without an epidural? The numbers matter. So, if they're supporting births where 90% of the moms are getting epidurals, there's nothing wrong with that. But if your goal is to avoid an epidural, that might be a red flag for you. Like, okay, why is that? Is that just coincidence that many moms that go to this practice for epidurals, or is it something to do with the routine interventions here and how supportive the providers are and, kind of what their philosophy is? Ask, what is your induction rate? What is your reason for most inductions? If the main answer is something like post dates or suspect a big baby, that just tells you kind of where their comfort zone is and when you're likely to be suggested an induction. Ask, what is your cesarean rate for first-time moms? Compare this to the area norms where you live. You can find the primary C-section rate for most hospitals online, but that's hospital-wide. And I think there's also some value in knowing specifically each provider's C-section rate for first-time moms. This is the information that they should have. They should know what their rate is. And if they don't know it off the top of their head, they should be able to find it very easily, and they should be willing to be transparent about it. If they are not forthcoming with this information, I personally would view that as a big red flag. Ask about their philosophy on time limits in labor. So if they're talking about failure to progress, they should be talking about the clinical parameters of failure to progress. What would qualify that? They should be talking about the difference between failure to progress parameters between induced labors and spontaneous labors, and what does failure to progress mean in labor versus failure to progress in the pushing stage. You can ask, how do you support freedom of movement? How do you support position changes? Like, are you going to make suggestions to help me change positions and try different things? How do you support my privacy and modesty if that's important to you? How do you make sure that my environment stays calm and low stimulation and relaxing? If they don't have a clear answer to those questions, they're not thinking physiologically. Another thing that I want you to think about as you're asking all these questions is listening between the lines of the answer. So sometimes the content of the answer matters less than their tone or their comfort level, or whether their thinking is like flexible or rigid. Do they seem bothered by your questions? Are they happy that you're taking an interest in trying to learn? Or are they sort of dismissing you or blowing you off or saying, well, just let us worry about that or something like that? Do they light up when they're talking about supporting physiologic birth? I'll speak for myself. I want a provider who is unthreatened by my questions, who welcomes me being engaged and involved, who can explain their approach to things without getting defensive, who sees me as a decision maker and an active participant in the experience, not just sort of a passenger who's along for the ride and who's supposed to go along with whatever they say I'm supposed to do. If they are bristling at your curiosity now, if they're writing you off now in pregnancy, dismissing your questions or making you feel, small or belittled or something like that, that dynamic is not going to magically go away when you're in labor. So finding a provider who will actually listen to you and do their best to answer your questions is paramount, because that goes right into your labor and birth experience. So you're not interviewing to be confrontational. You're not trying to trap anyone. It's not even necessarily that there are good answers and bad answers. I mean, some of them I would say are objectively bad. Like, there are some objective red flags, but for the most part, it's not even like there's good and bad. It's just like You have to determine, what do you want out of your birth experience? What are your goals? And then understand that who you have as your provider is such a huge factor in how likely those goals are to become realities, right? You're interviewing because you're hiring someone to steward one of the most sacred, vulnerable, God designed moments of your life. So you deserve a provider who respects physiologic birth, honors your autonomy, practices evidence based care, supports your values, and sees birth as something to protect, not just to control, but something to sort of support and come alongside you as the decision maker. Choosing the right provider is one of the most important decisions that you will make for your birth. I will put a link to Autonomous Birth Workshop if you want to really dive in more to planning an autonomous birth. If you learned something from this episode, please make sure to subscribe, and I would be so delighted if you would leave me a positive review. That just helps the show, it helps my business, and I will catch you next time.